Good morning. My name is Dr. Ikile. I'll be talking on infertility today to educate our women on what causes infertility and some misconceptions about infertility. What is infertility? Infertility is the inability of a couple to achieve spontaneous conception within 1 year, despite constant sexual intercourse. Despite adequate sexual intercourse. We'll see from that definition that we make mention of a couple, and that is the first misconception, where we think that issues of infertility is domiciled with the woman, and as such, many African homes will send the woman out, go and find why you are not pregnant. No, that is not. It's the inability of that couple. So in infertility investigation, it is very, very germane and important that both couple, the man and the woman, come out and be investigated. They actually see the gynecologist at the very first clinic together, not the woman going alone. That is because there are distributions of female causes of infertility and male causes of infertility. Also from that definition, I also made it known that after a year, that is because we want to believe that most couples, if there are no problems, at the end of 1 year, they should be able to get pregnant. So I wouldn't necessarily be investigating a couple after just 3 months of getting married or 6 months, because of the pressure of in-laws and the pressures of the society. They go running around wondering why they have not gotten pregnant. So the definition is clear-cut after a year of trying to get pregnant. And also that definition talks about adequacy of sexual intercourse. And adequacy of sexual intercourse simply means that this couple will have sex at least 3 times a week. 3 times a week on 3 separate days. So an example is like Monday, Thursday, Saturday, or Sunday, at least 3 times a week to try to achieve conception. If and when this doesn't happen after 1 year, then they can come out and look for why they are not pregnant. Sometimes a female may be the cause of why the couple is not getting pregnant, and sometimes it is the man. 40% of the time, it is the female that is the cause, and 40% of the time, it is the man that is the cause. And in 20% of the time, the cause is with both the man and the woman. So you can see that is another misconception that is being debunked. 40% of the time, the reason why a couple cannot get pregnant is the man. So it's very imperative that the man comes out for investigation. At the end of 1 month, in a couple that have no problem, just 20% of that couple, of the couple will get pregnant. Just 20%. And at the end of 6 months, just 50%. At the end of 1 year, just about 85 to 87% of couples that have no problem will be pregnant. And at the end of 2 years, about 94 to 97% of couples will get pregnant. So you see, that's why it's important to give a couple time to achieve spontaneous pregnancies by themselves. But if after a year you are not pregnant, then please come out, see your gynecologist for evaluation. Very important also, a woman's age has a big bearing on conception. Studies have shown that the perfect time for a woman to get pregnant, or the perfect time when her fertility potential is very, very high, is between 18 to 25 years of age. 18 to 25 years of age. But that is difficult in this day and age where women have to do a lot of studies, have to go to school, and people are deferring childbirth until their 30s. Okay? However, as a woman pushes towards her middle 35 going on 40, her fecundability, that is her ability to get pregnant spontaneously, reduces significantly once she hits the 35 years of age. So that is important for us to take note of. What are some of the causes of infertility? Could be that the woman is not ovulating. Could be that there's a problems with her tubes. Maybe her tubes are blocked from infections and other things. Could also be that the husband's sperm is not adequate, maybe in the number of the sperm, or the movement of the sperm, or the structure of the sperm maybe is not just adequate, or just hormonal imbalance in the woman. These are some of the reasons why a couple will not get pregnant. There are some times also that after all the evaluations, we still may not find why a couple is not pregnant. And in such situations, we say the couple has unexplained infertility because current tests is unable to identify where the problem is. Some tests that your doctors will tell you to do if you come for fertility evaluation is, one, you want to check the semen of the husband. I want to tell the woman to go and please do her hormonal analysis. You want to see whether she's ovulating. You want to see the interplay of the hormones and see whether they are proper. We also want the woman to check a tubal patency test because the tube is where the sperm will go into and where the egg will come out from. We want to see whether the tubes are also patent. So once we have done this, then we want to commence treatment based on the cause. In some situations also, once a woman is above 35, pushing towards 40, and she's coming for fertility evaluation, we also want to do a special test which helps tell about the ovarian reserve, whether the woman has enough eggs in her ovaries left for any action to be taken by the gynecologist. So as I said, the treatment for the infertile couple could be a treatment aimed at improving the husband's sperms, or a treatment aimed at helping the woman ovulate. However, in a situation whereby the tubes are blocked, such a woman, more often than not, will be referred for assisted reproductive technique. In this day and age, IVF has come a long way in helping many women who are infertile to make them fertile, to make them have their babies. And it's a very good treatment for women with tubal blockage because the eggs will be harvested and the husband's sperm will be added to the eggs. The baby, an embryo is formed and it will be put back into the womb. So infertility is common. About 10 to 15% of couples in Nigeria will be infertile. Please note that. And please, after a year of trying, please come out on time. However, if a woman is 35, if you're 35 years and you've tried for 6 months, please do not wait for a year. Come out. If you are less than 35, you can wait for a year. And please see a gynecologist for your evaluations such that the problems are quickly identified and solutions given to you. Because as we know, as we have said earlier, fecundability, that is the propensity of a woman to get pregnant spontaneously, and age is a factor. So the earlier you come out, the better. Thank you so much.